歡迎大家嚟到今日嘅簡報會。台上面3位醫生分別係衛生防護中心總監徐樂堅醫生、衛生防護中心傳染病處主任張竹君醫生同埋醫院管理局總行政經理何婉霞醫生。咁我先請阿徐醫生講。
各位市民、各位傳媒朋友，大家好。我先報告下現時我哋嗰個疫情嘅情況。近日呢，我哋疫情都係非常嚴峻嘅。我哋每日呈報嘅本地個案嘅數字呢，亦都係呈一個上升嘅趨勢。喺各方面工作呢，都備受啲壓力，亦都為市民呢帶嚟一啲憂慮。首先喺檢測方面，我哋明白呢，好多市民都非常之合作，做願檢盡檢。咁過去嘅1-2個星期呢，由於樣本嘅數量增加咗，等候檢測報告嘅時間呢，無可避免都有啲延長。市民呢，可能需要幾日先至收到一啲檢測嘅通知。政府呢已經係陸續提升本地化驗所嘅檢測能力，包括呢訪問實驗室已經投入運作。近日大家都見到啦，我哋都得到內地專家嘅大力支援，相信呢喺短時間內可以逐步提高本地嘅檢測能力。令到市民呢等候檢測結果嘅時間呢可以逐步咁樣縮短。另一方面呢，係市民收到檢測陽性或者初步陽性嘅通知，佢哋喺等候入院或者其他隔離設施呢嘅焦慮。我哋希望大家都理解，以現時我哋個案增加嘅實際情況，政府呢已經係努力不懈，循多個途徑呢，希望喺短時間之內增加社區隔離設施嘅數目。大家可以見到呢，我哋嘅社區隔離設施嘅酒店計劃呢已經開始運作，幾間酒店呢已經轉為作為隔離設施，並且已經投入服務。此外呢，喺竹篙灣由內地援建嘅社區隔離設施呢，亦都已經啟動。連同埋啟德嘅用地呢，我哋將會建立一個約1萬個社區隔離同埋治療嘅單位。日後呢，接收病人嘅量呢將會大大提升。但係喺設施容量有限嘅情況之下呢，我哋都必須係要現實地將現時嘅床位同埋單位呢係預留俾最高風險嘅病人。由於冇病徵或者病徵輕微嘅個案呢，亦都可能需要留喺家裏休養一段時間。我知道政府同時亦都盡快安排一啲比較高風險嘅人士進入醫院或者隔離設施。
We are doing our best to send patients to hospitals and isolation facilities. For patients waiting at home with no or mild symptoms or preliminarily positive patients, we urge them to adopt infection control measures. First, you should separate with the family members and take your body temperature regularly. And you should pay attention to the updates and guidelines in terms of infection control on our website. On the thematic websites and the HA websites, you can have access to the most reliable information. For patients with no or mild symptoms, the government and the HA are offering appropriate treatments to them. While staying at home, you must pay close attention to your health. For people who have been vaccinated, usually the symptoms would be mild. If there is any change, you should call our hotline and make an appointment at the designated clinics. We have prepared information package for these patients. The packages will be delivered to them via logistics companies. And also you can log on to our website for the latest information. The infectiousness of the patients would reduce over time, especially for those who have been vaccinated, and the risk posed to family members would reduce over time. For patients with mild symptoms, their health condition would improve gradually. To play safe, we recommend a rapid test on the 14th day at home. If it is negative, then we believe that the patient will have recovered and he can resume any normal activities. For family members and household members, according to the Stay Home Safe plan, they should undergo 14-day quarantine at home. The HAD is running a hotline to provide support. For patients who have yet to receive an information pack, please find the information online. Our team and our contractors will deliver the information pack to your doors as soon as possible. Because of the increase in the number of active cases, we need to continue to impose social distancing measures. Do avoid going out and unnecessary gatherings, including cross-household gathering. For those who are yet to receive a jab, please do so soon. If you need a third jab, then please get a third jab. Vaccines can effectively reduce the risk of complications and fatality, as well as the risk posed to your family members. To protect newborns, if there are no other contradictions, pregnant women should also get vaccinated. We want to get the information of preliminary positive cases and your family members as soon as possible, so that we can assist your stay-home safe isolation period. So please give us your information via the telephone so that we can help you. If you are not tech-savvy, we will get in touch with you via the telephone. And please wait patiently. I would like to thank our colleagues, including government colleagues as well as volunteers. In the past 2 years, especially during the recent wave, they have been providing the best services to members of the public. I also call out to major corporations to join hands with us and fight the disease. We hope that major corporations can organize volunteer teams to support your colleagues who are infected, including disseminating information, distributing rapid test kits to alleviate the concerns. We urge members of the public to stand together with us in this fight and overcome the epidemic. Thank you.
Dr. Chuang will tell us about the latest situation about the cases. As of last night, the HA lab and the CHP's lab confirmed a total of 6,067 cases. 2,733 such cases were confirmed by the Hospital Authority lab. 3,334 cases were confirmed by the Center for Health Protection's lab. 32 cases were carriers of the L452R strain, meaning suspected Delta carriers. 3,188 cases tested negative to the strain, meaning they are suspected Omicron carriers. 114 cases are pending tests or could not be tested due to the low viral load. For the 6,067 cases, 12 of them were imported cases. The rest of them, 6,055 of them, were local infections. In terms of the trend, you can refer to the figures we reported every day. From the 15th to 17th February, the daily case count was around 4,000 cases per day. On the 18th of February, we got 7,000 or so cases. As at yesterday, we got 10,000 or so cases. The overall trend is an upward trend.
即係雖然做咗好多呢個社交距離嘅措施啦
social distancing restrictions have been put in place, and there may be a need for such measures to stay in place. For elderly care homes and care homes for the disabled, we have more than 240 such cases that have reported one or multiple infections involving residents or staff members. As of yesterday, at least 197 staff members and 672 residents have tested positive to either a PCR test or rapid antigen test. That's all from me for today. Over to Dr. Sarah Ho. Good afternoon, everyone. As of now, we have 3,701 patients testing positive or preliminary positive, receiving treatment at the North End Hospital, Hong Kong Infection Control Center, the Hospital Authority Infectious Disease Center, and the Asia World Expo Community Treatment Facility. We have close to 2,300 patients staying at the Penny's Bay Community Isolation Treatment. More than 200 patients are staying at the Tsuen Wan Community Isolation Center facility. 14 patients have passed away. 227 patients were discharged upon recovery. At the isolation beds in the public hospitals, the occupancy rate is over 90%. That's the maximum capacity at which we can receive patients. I want to make an appeal to all sectors of our community. Let's support our healthcare workers in overcoming this crisis. First, we called upon private sector healthcare workers to join us. We are aware that many private hospital workers stand ready to help us in various ways to take off some of the pressure on public hospitals. The hospital authority have liaised with private hospitals and the associations of such hospitals. We are discussing relevant arrangements, and we will implement the arrangements as soon as possible, and hopefully that will help our public. In the previous 4 waves of outbreaks, we had all kinds of collaboration with private hospitals. We had public-private collaboration schemes where we referred patients to private hospitals for care. This helps a lot in taking off pressure on public hospitals. In the days to come, we will step up communication with private hospitals. One of the plans under consideration is to get private hospitals to help us look after patients who are recovering so that we can free up more manpower and beds in public hospitals to fight COVID. Second, we want to thank all government departments and bureaus for all their help over the past few days in sorting out problems involving patients waiting outside A&E departments for hospital admission. We will continue to work with government departments to deal with all the problems that may occur, including by identifying more indoor areas and premises and turn them into community isolation facilities and transporting and supporting patients. I believe all departments will work with us in dealing with the COVID crisis. Third, I want to thank our frontline workers. This is a very trying time and an exhausting experience for our workers who work tirelessly in looking after patients. They don't even have time for a meal break. I want to thank them wholeheartedly. We will keep reviewing the work environment and arrangements, and we will look into ways to help our workers do their job. We will look into ways to relieve some of the stress and improve the work environment, and we will consider such options. I also want to take this opportunity to let patients waiting for hospital care know that I know you're waiting a long time before you can get to see a doctor. I know many people are upset, and it's hard for you. I understand there may be frustration, but please do not take it out on our workers. Our staff members work very hard to help you, but there is a surge of patients at hospitals. No matter how hard our staff workers work, some may be left disappointed. I call for mutual understanding on the part of the public so that our workers can focus on looking after patients. The floor is now open to questions. Before putting your questions, please tell us your media organization. Journalist at the back, the journalist in black. Now TV. First question. You said that social distancing measures will remain in place. The measures were tightened 10 days ago, but we're still seeing cases going up every day. Does it mean there's a falling behind in the restrictions and the rise in cases? Is there a need to further tighten the restrictions? Now you have moved patients waiting outside hospitals into indoor areas. But where are you keeping the patients now? Are these indoor areas up to the standards required of isolation facilities? If you move them inside and the places are not up to scratch, wouldn't that add to infection risks? You also mentioned collaboration between public and private hospitals. So some recovering patients may be referred to private hospitals, as you said. So what's the position of the private hospitals? What kind of services and patients will be referred to private hospitals? I'll take the question about the social distancing measures, and Dr. Sarah Ho will tell us about the hospitals and the private-public collaboration. The social distancing measures as they stand and the case count so far. Over the past 5 days, as Dr. Chuang was saying, the first 3 days, the daily case count was relatively stable, roughly 4,000 cases or so every day. But as of the day before yesterday, the daily case count rose to 7,000. Just then, we reported roughly 10,000 reported cases. So that's an upward trend. We will have to observe the situation for a longer period of time. The communicable period will last for a few days. So we will have to closely look at how things go in the next week or two before we can tell whether we can contain it. Social distancing measures requires public cooperation. As we made our appeal just then, we're asking people to avoid going out, avoid unnecessary gatherings, especially cross-family gatherings, get vaccinated as soon as possible. These steps will help us flatten the curve. Let's work together, and we will keep in view on the daily case count in the next few days. Over to Dr. Sarah Ho. We're discussing matters with private hospitals. They are very positive and they're willing to help. They're willing to help the hospital authority and fight COVID together. We have discussed various proposals. One such proposal is to have recovering patients taken care at private hospitals, but discussion is ongoing, and we will discuss the various aspects of the proposals, and hopefully we can agree on all kinds of options to offer care to patients. And we also mentioned about letting patients wait indoors at hospitals. We're using the space at physiotherapy areas or staff break rooms to let patients wait indoors. There are basic ventilation equipment in these areas, but we will also take steps to improve the ventilation. So we will have portable purifiers or HEPA filters in those areas, and they will help reduce infection risks in those areas.
Next question, please. The reporter in green, cable news. Now about the occupation rate of ICU, what's the utilization rate? If there are more critical patients, will we run out of ICU units? How can the HA deal with the problem? And how many critical and serious patients do we have today?
17號起咧，其實
Since the 17th this month,
就冇公佈幾多人危殆
the HA
同埋即係會唔會之後會公佈翻點解唔公佈
daily press release and
咁另外
the number
最後
of
就有
critical
專家建議
patients
就係
were
當
not
局就制
mentioned.
定一
Why
個
is
指引
that?
係俾一啲確診者係
And the HA
其實
will
當局會唔會有呢個諗
provide
法或者係有相關嘅
guidelines
指引推出嚟？
for confirmed patients on how to keep safe at home. So when will we have the guidelines? Now, in terms of patients waiting at home, I will defer to Dr. Sarah Ho about the number of ICU units and the number of critical patients. If you look at the number of cases and the number of facilities we have, inevitably for mild patients or patients with no symptoms, they will have to stay at home before hospitalization, and maybe they would have recovered before the 14 days period ends. We have to reserve our beds for patients with high risk. As announced on our website, we are telling patients what they should pay attention to if they are waiting at home in terms of infection control, how family members can offer help. We also want to provide rapid antigen testing kits to the patients at home. On the 14th day, if the antigen test come back negative, it means that they have recovered and they can leave home. And no isolation arrangements will be offered. So this is a pamphlet like this. It is also available online. For patients waiting hospitalization, you can download these information from our website. Dr. Ho? The utilization rate of our ICU is about 60%. As our Chief Executive of the HA mentioned, during the Omicron wave, patients often have mild symptoms. So the number of Omicron patients requiring ICU treatment is lower. For elderly patients, however, some of them require further treatment. We would discuss with their family members in terms of the best course of treatment. When a patient is moved into ICUs, there will be invasive procedures involved. So we will have to discuss with the family members on whether it is the best option. In terms of number of critical patients, we have more than 10 confirmed patients in critical condition. For patients in serious conditions, there are a score of them. Because of the sheer number of patients, we will give you an update in a consolidated manner as the press briefing. The lady in the middle.
你好 TVB 嘅。
Good afternoon, TVB.
問一問啦，頭先就講到即係嚴重嗰個病人嘅人數係
Now you said the number of serious patients are several tens of them. So how many exactly?
即係繼續考慮呢一個維持而家嗰個社交距離啦。
So you said the current social distancing measures would continue. However, Professor Sophia Chan said today that the social distancing measures might be further tightened. The measures, as they are already very stringent, so how will they be further tightened? Will you consider a full-day dine-in ban? In terms of testing, because of the shortage of manpower, people have to wait a long time to get the results. According to the experts from the mainland, after the logistics issues are sorted out, they will start testing work immediately. Today, the specimen taking teams are still sorting things out, and they are not offering their services yet. So when will we get the help? And vaccine pass will be put in place soon. Security guards at malls will not check people's vaccination records. So how effective will it be? You said Only when it is necessary will law enforcement agencies enforce the law in restaurants and malls. So why are there different standards for restaurants and malls? I will take the first three questions and then I will defer to Dr. Ho. Now the social distancing measures are mentioned. According to our judgment, amidst the rising trend, we can definitely not relax the measures. They will be maintained or even further tightened. If we are to tighten the distancing measures, there will be several options. For example, minimizing the period of minimizing the dining period. So we will work together with the government to see whether we have to tighten the measures. At least the measures will have to be maintained. In terms of testing capacity, as you can see, we have been increasing our local testing capacity from 100,000 per day. The number has been rising rapidly. Now we have the mainland teams. We hope that we can have the input soon and ramp up our testing capacity. In the past, you may get the results in 1 day or 1.5 days. Now the time required will be lengthened. Now with the enhanced testing capacity, the waiting time will be reduced again. In terms of vaccine pass, I think we understand that we are trying to encourage or use stricter measures to tell people that vaccination is indeed critical. For high-risk place, where you have to take your mask off, we will be even stricter. We have to ensure that people who enter these venues are vaccinated. For other places, it is rather difficult to check whether people are vaccinated. So we are relying on people's self-discipline. If you are entering malls, after the vaccine pass scheme is implemented, if you are not vaccinated and you enter a mall, you will be breaking the law. So we may have law enforcement agencies performing checks at these venues. So I call for the public's cooperation. We also call for the cooperation of malls to make sure that visitors have been vaccinated indeed. The situation is indeed serious. We rely on collaboration from property management companies and malls and people's members of the public to help us.
For patients in serious condition, we have dozens of them. But I believe you can understand that there has been a surge in the number of patients. Some tested positive, others tested preliminary positive. Our staff focused on treating the patients because we will require other staff to compile the figures and update them. Next question, journalist at front, the journalist in beige. Phoenix TV. Over the past 4 days, we have seen the daily case count has exceeded 6,000. If the increase goes on, does it mean that it would be hard to prevent the recurrence of a situation where patients have to wait in the cold outside hospitals? We have also seen recent reports that patients at A&E departments, one healthcare worker will have to look after more than 60 patients. Do you have the stats? Like how many patients does each healthcare worker have to look after? Are there ways to alleviate the problem? We are seeing infections at care homes. Some residents have been in quarantine at Asia World Expo for 7 days, and then they're asked to return to the care homes to complete the remainder of the quarantine period. But are the care homes suitable for the quarantine? Wouldn't that add to the infection risks for other residents staying at such care homes? I'll take the question about Asia World Expo. Dr. Sarah Ho will tell us about the situation at A&E departments. In terms of the daily case count and the trend, we expect many cases to come up. Whether it's hospital admission or home quarantine, there are things the public should watch out for. As for the Asia World Expo, quarantine, we're trying to strike a balance between the number of patients that we can accommodate at the Asia World Expo and other things. There may be residents of resident care homes staying at the Asia World Expo. After 7 days of quarantine, we believe the risk of an onset may be lower and low enough. But there is also a need to take in people who may be at a high risk of an onset. So this is a risk assessment, and we need to strike a balance here. We need to maintain a balance and make sure the risk is manageable. So that's why some residents are sent back to the care homes after 7 days so that we can free up the space to receive residents who are at a higher risk. And after a resident is sent back to the care home, we have infection control guidelines that will be made available to the relevant care homes to help them lower the infection risks and what to do if there is a reinfection, especially when it comes to things to look out for when the staff look after the residents. Over to Dr. Sarah Ho. As you are aware, there are thousands of infections every day. So this is a huge base number. Even if 10% of such patients go to A&E departments, that's a huge demand on A&E services. So we try to get patients waiting to stay indoors. It's cold today and it's raining. If there's a surge of patients arriving at A&E departments, we will be hard-pressed to get everyone indoors. So we do our best. We try to show empathy in our approach. And in terms of our staff manpower at the A&E departments, it's stretched. Given the surge in patients, we're under tremendous stress. But we will keep in view the situation and we will deploy our manpower and where necessary. So that's all from me. We'll take an English question at the back. Far end， 我係香港電台嘅。咁今朝陳肇始教授就話政府研究緊再收緊社交距離措施。咁而家考慮緊啲咩嘢措施咧？關於整體疫情咧，而家每日嗰個確診數字其實有冇全面反映緊個感染咧？因為始終仲有好多人仲等緊檢測嘅。你都講過嗰個電子嘅，即係用電子方式匯報自己確診情況，可唔可以講講嗰方面嘅詳細安排咧？仲有就係關於病人嗰度咧，而家啲公立醫院外面仲有幾多病人等緊？另外我想問詳情嘅就係私營醫院嗰度咧。政府會唔會考慮向私營醫院買床位咧？咁而你哋又會點樣決定邊啲病人會送去私營醫院嗰度治療咧？咁有啲低收入嘅家庭就話咧，佢哋喺家居檢疫嘅時候等咗好耐啦，都冇收到政府嘅支援。而呢啲其實係喺佢哋有啲家人已經檢疫咗之後嘅事。咁政府到底有冇對啲草根嘅家庭提供支援咧，即係講緊對啲喺家居檢疫嘅人有冇提供支援咧？而嗰啲屋企居住環境比較擠迫嘅人，會唔會優先可以送院或者送去隔離設施咧？我首先答咗你關於家居檢疫嗰個問題，同埋等入院嘅嗰方面嘅嘢。咁何醫生就會解答翻醫院嗰邊嘅問題。係嘅，我哋的確都收到一啲
and also for those who are waiting to the
關於
hospital.
喺家居檢疫
And
等緊送
indeed
院
we
嗰啲人
have different hotlines
我哋
which
有
can
唔同
cater
嘅熱
for
線
different
啦，
needs of different
可以
people.
照顧唔同
So
人嘅需要。
this is one of the 14 days home
呢個
quarantine
咧
booklets
就係一
which
個
we have imposed to
一個小
the
冊子，就
website.
俾嗰啲家居
And
檢
we
疫
are also
14日嘅人
delivering
可以
these
掌握呢啲
packages
資料。
with
我哋
the
會送呢
rapid
啲
antigen
資訊
tests
包
and
咯，
also the
連同埋嗰
thermometers
啲
to
快速
those
檢測
under the
包
home
啊、溫
quarantine.
度計啊，
But
我會將呢啲嘢送俾嗰啲
because
家居檢疫
there
人
is a
士。
surge of
咁
cases
但係因為
and
最
also
近
the surge of home
嘅
quarantine confinees
呢
in
啲檢
Hong
疫嘅
Kong.
人數大
So
增，
we
個
are
案數確診
expediting
數目大
our
增。
delivery
所以我哋都
schedules,
會加快
including we will
派發呢啲
invite
資訊
some
包。我哋亦
companies
都會
for
邀
the
請一
delivery
啲
work
私人
for
嘅
us
公司
so that
幫助我
we
哋
have
派呢啲
to
資訊
deliver
包俾
all
呢
the
啲
packages to the
檢疫
people
嘅
under
人士。
quarantine and those waiting to the hospital.
咁嗰啲等入院嘅人士亦
more
都會
quickly.
收到呢
So
啲資訊包。
for the testing arrangement,
關於檢測嘅安排，
yes, we are upgrading, equipping
我哋都
our testing capacity. Yeah,
提高緊我哋嘅檢測
with
量
the
啦。
help of the mainland
因為我哋而
mainland
家就
experts.
有
So
內
we
地嘅支
expect
援啦，
the
啲
we
內地嘅
expect
專
the
家都有
testing
幫我
capacity will
哋。
increase
我哋都
soon.
預期
So
咧，
to cater
喺
for
檢測嘅
the
量都
need
可以喺
to
不久
test
嘅
and
時
also
間內
because
可以
of
提高
the
嘅。
rising trend of the reported case in
因為
Hong
畢竟
Kong.
我都明白
So,
嗰個確診數字依然係會上升嘅。
In view of the cold weather and also the
而家
raining
天氣好凍啦，
situation,
而
we
且出
have
邊落緊雨啦
mobilized
我哋都
all
動員
the
咗，
available indoors area,
我哋都用
including the day
所有
center
內
and also
室內嘅
some
地點，包括一啲日間
physiotherapy
嘅服務
departments
嘅地
indoor
點啦，或
area
者係一啲物理
to
治
let the
療
patients
嘅
move
地方，
inside
等
indoor
啲病
instead
人
of
可以喺
outdoor.
室內等，而
And
唔使
at
再
the
企喺室
moment,
外
and
等。
only a few
咁喺呢一
number of
刻咧，
cases while waiting for the
暫時我哋
triage
只有
staying
少
indoor.
量嘅人
But at the same time,
仲等
if
緊
there is a
分
large
流嘅。
influx
但
of
係如
patients,
果喺短時間內有
inevitably
大
some of them may
量
need
嘅
to
病
wait
人
for a
到
while.
醫院，咁可能就真
And
係
for
要
the
等啦。
private hospitals,
至於私人
and
醫院嗰
they
邊，
are very, they show
呢
they
啲私
show
營醫
positive
院咧，
to
態度都好積
help
極嘅。
to take care some of
佢
our
哋都好
patients.
肯
The
幫手
initial
幫手
directions are
照
taking
顧一
care
啲
of
病人。
those convalescent patients,
咁嗰啲
and so
療養
that
緊康復
free
緊
up
嘅
some
病人咧，佢哋都可以
capacity
接
in
收，
hospital
等
authority to
醫
take
管
care
局嘅醫院咧
COVID
就可以
confirmed
騰出一
and
啲
preliminary
人手
confirmed
資源咧
patients.
嚟照顧一啲
And
確
for the
診咗或者初
patients,
步
while
確診
they are
嘅病
waiting
人。
to be admitted,
至於等
for
緊
those
入院嘅
preliminary
病人，
confirmed
即係講
patients
緊
to
啲
be
初陽
admitted,
嘅個
we
案，
set
等
up
緊
some
入院嗰啲
hotline
病
so
人
that
咧，
they
我哋都
can
已經設
call
立咗熱
to
線，等佢哋可以
inquiry
打去個
about
熱
some
線
infection
查詢
controlled
關
or
於
general
防疫控制
information.
或者係一般
In
資料
case
嘅
they
嘢。
have symptoms,
如果
they
佢
can
哋呢啲病人出現
pre-book
咗病
the
徵咧，佢哋都
designated
可以預
clinic
先
so
預約
that we
嗰
have
啲
some
指
doctors
定
there
嘅
to
診所，
provide medical consultation to them.
等我哋可以
I'm
提
sorry,
供
I forgot to answer your
支
question
援。
about the
唔好
electronic
意思，頭
form.
先我
Yeah.
答漏咗嗰個電子表格嘅
We
問
spend
題嘅。
we spend quite resources to
我
call
哋都用
all
咗
those home confinees and
資源
cases
啦。
to obtain the
我哋就
information
打咗
about
電話俾嗰
their
啲家
home
居檢疫
confinees
人
name
士，我哋
and
攞
also
到佢
their
哋
address.
嘅名啊、
So
地址啊呢啲資
we
料。
are enhancing these measures
我
by
哋都
using an
加
SMS
強緊呢方面嘅服務啦。
message
例如我哋都
to
用
the
到短信服務
to
啦
the，cases so that they can reply us through a electronic form.
等呢
And
啲
they
呢
can fill the
啲
information
人士
to us
可
like
以
the
用電子嘅
number of
方
home
式
confinees,
提供
the
翻呢啲資
name
料，
of the home
佢哋譬
confinees
如佢哋啲
and the
名
exact
啊，
address, so that
佢
we
哋嘅
can
地址
deliver
啊，
all the
等我哋
packages
可以派送
and
嗰啲
to
資
further
訊包，
communicate with the home confinees more speedy.
而可以係盡快同佢哋溝通。
問多條英文問題啊，前面嗰位。
Another English question. 唔好意思，講者冇用咪。
Yes, I do think the current figures
關於而
reflect
家嘅數字
the
咧，其實
trend of the infections and
關
spread
於
in
係咪
Hong
反
Kong.
映
Yeah,
緊咧而
because
家香港嘅情況，其實反映出
Hong
香
Kong
港嘅傳
people
染
are
速度
quite
好快。
concerned about
其
this
實我哋好擔
virus
心
and they are eager to go to
呢個
test.
病毒嘅問題，
So
所以好多香港人都
what we need to
趕
do
住去
is to equip our testing
作出呢個
capacity
檢
to
測。
cater with
咁
this
所以我哋會係不斷提升我哋嘅
increasing
檢測能力
demand.
啦，去應付呢個不斷 斷上升嘅需求。
Good afternoon from
係你好，
SCMP
我係南
News.
華早報
I'd
嘅。
like to know for the 14 deaths today, can we
關於
have
今
a
日嘅
breakdown on
14
the
個
age
死亡
gender
嘅
and whether how
病人咧，佢
they
哋
are all
嘅年
vaccinated
紀
or
同埋佢
not?
哋嘅性別係
And
點？佢哋有
also
冇打針嘅咧？
the same for the serious cases
咁關於
and
嚴重
critical
個案都係啦
cases, what's
同
the
埋呢
age and the
個
gender breakdown?
誒
And also in terms of getting the
啊
private hospitals to help,
誒
how many
危險嘅個案都係
more
啦，佢哋嗰個
patients can
嘅
these
年
private
紀同埋個
hospitals
性別係
receive
點
in total during the wave? Thank you.
咁喺呢一波之中，究竟收到幾多個咁樣嘅病人？係請阿何醫生。 關於今天嘅死亡嘅個案，我哋有大概10個嘅病人啦，多數都係老人家嚟㗎，係由70歲去到98歲，7男7女。
And for those serious, we have also a few dozens of cases, and
幾
majority
十個
are also elderly.
個案，咁
For
多數都係
the
老人家嚟。
preliminary contact or discussion about the arrangement with private hospital is still in the preliminary stage. The initial direction is to transfer those convalescent patients to them. The estimation of the scale and number are
關於
still
嗰
under
個數字同
discussion.
埋規模咧，仍然都喺討論之中。唔好意思，講者冇用咪。
Okay, so allow Dr. Zhang to
係
respond.
請阿張醫生回應。
We found that the preliminary
我哋
positive
發現
case
初步
does
確
not
診個
reflect
案咧，
actual
其實就
trend
並非
because
反
some
映
of
現
the
時嘅
preliminary positive
趨
case
勢，
they
因為
have
有啲嘅
been
初步確
preliminary
診個案
positive
咧，
for quite a
其實
while
已經係
because
一
the
段時間都
specimens were
係
not
初
sent
確咗，
to our
因為佢哋
laboratory.
嘅
So we
樣本啦
try to
係
use the daily notification
未送過嚟
figure
我哋嘅
to
實驗室，
reflect the actual trend.
咁所以
So
咧
the
係
figures are reported just now.
嗰個現時嘅趨勢就係正如我所彙報嘅數字一
呢
樣。
邊前面呢位。
Next question please, the
你好，
reporter
香
over
港
there.
01嘅。
Hi,
我
Hong
想
Kong
問一
01.
問而家社區就好多自行檢測咁。
Now in the community, many people have been tested preliminarily positive from by self-test.
嘅派樽點咧，其實咧
However, they can't get a bottle for a
咁政府
confirmative
有冇
test
一啲
at
計劃點樣解決咧？同埋要
collection
加多呢
points,
啲檢測
bottles
樽嘅數量有咩難度咧？
are
第二
cleared
就
out
係
quickly.
問
So how can we
而家
ramp
好
up
多市
the
民都反映話，其實指定診所熱
capacity?
線或者其他嘅支援熱線
According
咧
to the
就長
public,
期打唔通或者冇人聽
the
嘅。
support
有冇
hotlines
話
or the hotline to
要
book
點
a
樣去
place at
加大呢啲
designated
熱線嘅
clinics
線路同埋人手咁樣
they
咧？
can't get
同
through.
埋就
And
想問一問，因為
so how
頭
can
先
we
咧就收到消息就話有醫護爆料咧，就話博
solve
醫院
the
嗰邊咧
problem?
就有個病
So
房
according
就
to
有20至
anonymous
30個
reports,
病
there
人
is a
同埋
ward
醫護確診嘅。
where
想問
20 to
有冇呢
30
件事發生？
patients,
唔該晒。
including medical staff,
我先回應咗
infected.
個
So can you
快速
confirm
測
the
試嗰個
report
需求同埋
about
個
the
後續？
demand
咁
for
啊，何醫生講講關於醫院
rapid
管理局
antigen
嗰個
tests? I will address the issue, and then
中
Dr.
心前
Ho
線個
will
案
answer another
快速
question,
測
and I will,
試
Dr. Zhang will tell you about the Port Hoi hospital
因為好多
situation.
市民其實
Now, the
而家
demand
我
for
哋
rapid
都會
tests
佢
is
自己都有啲快速測試啦
huge.
嚇。咁但係個問題係快
Many
速
people are
測
doing
試
tests
出嚟之後咧，
themselves.
現時我哋都希望做一個確認嘅，因為
We
始終即係都
wants
有
to
機會啊，
do
快速測試都有
confirmatory
啲
tests on
即
these
係誤差。咁所以
rapid
我哋
tests
明白
because
咧，快速測試嘅需求大，
it's not
個執
100%
行多嘅時候咧，個後續工作我哋都要提升嘅。咁所以喺
When the
嗰
number
個後續
increase,
工作，例如係
more
嗰
follow-up
個
work
生物
will
唾液嘅樽嗰度
be
個派發
required.
啊，我
For
哋都要
example,
加強嘅。
dispersing
另外，我哋亦
deep
都
throat
係而家喺度考慮
saliva
緊有冇一啲其他
specimen
嘅方案可以
bottle,
協助到快速測試陽性之後咧，
and also
做
we
一個跟進
are
嘅工作嚇。呢個我哋
devising ways
即係
to
內部
follow
而家
up
喺
on
度
preliminary
希
positive
望盡快可以俾到一個
cases
資
discovered
訊
by
大家，
self-test.
睇下點樣去跟
More
進翻
details will be
快速
available
測試
soon
陽性之後嘅後續
on
工作。
how we will follow up on these preliminary positive cases. Dr. Ho,
指定診所
about
咧，咁
designated
就截至
clinics,
琴日下晝咧，
as at
我哋轄
yesterday
下
afternoon,
7間冠狀病毒確
the
診個案
7
嗰個指定診所
designated
咧，
clinics for
其實
COVID-19
已經超過
cases
3200位嘅
have
病人咧，
received
我哋幫
all
佢
over
提供咗醫生
3,200
診治
patients.
嘅服務。
Consultation
咁
and
咧，
treatments
另外
have
咧
been
就
offered
即
to
係我哋
them.
每一日咧大概
Every
嘅
day,
籌咧就1000零多宗籌
we
啦。
are issuing
咁
more than
琴日咧
1,000
就大概
tickets.
處理咗800幾名
Yesterday,
病人嗰個即係診症啦。咁我哋
some
睇到
800
咧，其實
patients
有一啲部分地區
received
咧就可能
treatments.
個案比較多啦。
In
咁
some
嗰邊咧
districts
就
with
可
more
能即係個
cases,
需求就會大
the
啲。
demand would be
咁
higher.
我哋咧都會睇翻個情況咧，
Depending on the
有需要咧，可能我哋
situation,
都會加大有一啲地區個診所
we
嗰
may
個即係需求啦。咁
increase
我
the
哋睇翻咧嗰個指定診所
or extend the service provided by designated clinics in
咁
certain
都係攞一
districts.
啲簡單
Most of the
舒緩病
patients
徵嘅藥
have
物
mild
咧，
symptoms.
其實都幫到佢哋。
They
咁
only
至於個
require
電話熱線嗰度咧，其實我哋都有
simple
即係
medications
加大緊
to help
嗰
them.
個
In
即係
terms
服
of
務
our
量。
telephone
咁
hotline,
嚟緊
we
咧，我
are
哋都會睇住
also
個容量嘅
enhancing
情
the
況。
service.
咁可能咧，我哋
We
都會
will
再
pay
擴
attention
充
to
嗰個
the
服務。
to the number of callers, and we may expand the service. We have a lot of help from nurses, pharmacists, and our allied health teams. We hope that more colleagues will join us. In terms of the Top Boy Hospital situation, I don't have any information right now. More details will be available after investigation. Next question, the gentleman in the middle. Hi, AM 730. Now you said the number of cases has been on the rise. So besides of community isolation, is it because of the sheer number of CTNs issued? That's why there is a delay in terms of returning testing results. Now, patients on convalescence, are they from hospitals with A&ED or those hospitals without A&ED? How many patients will be received? Now, you said the entire hospital may be converted into a COVID-19 patients hospital. So under what circumstances will we activate this plan? Now, for the critical patients, what are the ages and how many patients were transferred from designated clinics? Finally, about collecting patients' information via the electronic form, how will it work? Will the CHP call the patients, or will they just receive an SMS? And how can we avoid fraud or the fraudulent cases? Now about the trend of cases and about the arrangement of SMS notifications. Now about the rising trend. It certainly has to do with the community outbreak. When the base number is huge, when one patient can infect 3 patients, then we will have a lot of cases. On the other hand, we have transmission within families. If one family member is infected, the other family members will be infected as well. And also the number of isolation facilities cannot catch up with the need. Ideally, all confirmed cases should be housed at isolation facilities. Because of the bottleneck we need help from family members. Positive patients may have to stay home and lower the infection risk by adopting our instructions or guidelines. Well, 2 days before the onset or during the incubation period, other family members might be exposed to risk. So even if family members are infected, don't be overly anxious, just pay attention to your health condition. So like Dr. Sarah Ho said, if you have no symptoms or mild symptoms, you shouldn't rush to A&ED and join the queue, because we have a different medical needs. So like our pamphlet said, if you are confirmed, you can adopt measures to lower the infection risk to other family members. If there is any change in your health conditions, of course you have to seek medical assistance. We have hotline and we have dedicated clinics to offer help. In the near future, when we are able to increase the number of isolation facilities, then high-risk patients especially those with high viral load during the initial period of infection or those from high-risk groups will be moved to isolation facilities. About the SMS, that's one way to help our tracing work. Previously, we would call each and every case for the information, including the constitution of the family members, the names and ages and so on. When the workload is heavy, even if it just takes 5 minutes for each call, we will never catch up with the cases. So we are relying on technology here. For members of the public who are able to fill in the electronic form, please fill in the form and at least let us know how many family members are there, and then we can deliver the packages to your door. We are treading very carefully because we don't want the system to be exploited by criminals. Patients will get a SMS, so if they can fill in the electronic form, it will surely help our work. When we want to remind patients about government's instructions or so on, we would do so by SMS as well. We understand that some people are not tech savvy, so we would use the conventional way, that is call the patient up. We will adopt every measure to speed up our tracing work to cope with the number of cases. Dr. Ho?
For patients in a critical condition, I do not have a detailed breakdown. Most of them are the elderly. For those relatively younger, they suffered from underlying illnesses, turning to designated clinics. Patients who require transfer to hospitals, well, I don't have the data on such cases, but for designated clinics, these are clinics for those symptomatic patients but with mild symptoms. Based on what I have now, most of them got some medication and then returned home. And as to the kind of patients that may be transferred to private hospitals, these are patients, recovering patients, or those under infirmary care. They may be found at A&E departments or one of our infirmary care institutions. So this will require further discussion between us and the private hospitals. We would discuss in further in detail about the number of patients, etc., because this is just a preliminary plan as of now. There's huge demand for hospital care. After all, we have many confirmed patients or patients who test preliminary positive. Government departments are identifying suitable premises for community isolation facilities. We are considering many different proposals. One, for example, designated places for preliminary cases of COVID patients. We are considering different options. Next question. We take two more questions. At the back, the gentleman there. Ming Pao. First question for the hospital authority. Can you give us a breakdown of the isolation facilities under the hospital authority? And for the patients who passed away, how many of them were vaccinated and how many of them were unvaccinated? And a question for the Center for Health Protection. Just then you mentioned the use of SMS to ask members of the public to provide information. Do they just have to provide their names, the size of the household, and their address? When will this measure kick in? We received a complaint. The wife of this complainant tested positive on the 9th of February. They underwent 10 days of home quarantine And only then they got a call from the CHP, and they were required to undergo another 14 days of quarantine, so they had to stay home for an entire month. So they were wondering if the authorities failed to consider that they were already under quarantine for some days. What's the response from the CHP? If a close contact underwent quarantine before receiving the quarantine order, do those days not count? Is there a delay in the handing out of quarantine orders? Just then, other journalists asked for preliminary positive cases. So are you going to stop announcing the preliminary positive cases? Why? Will this remain the case forever, or will you re-announce preliminary positive cases again once you have fewer cases? I will first address the point about the use of SMS and then the complaint, followed by the figures announced every day. And then Dr. Ho will tell us more about the other things. The SMS, the measure is not in place yet. When we had fewer cases, we could rapidly reach out to the patients over the phone and get out information. But every time we make a call, it takes time. When you have many cases, calling people up will lead to delays. So we are considering other options, such as getting the patient to fill in essential information, the number of family members in the household, their names, the phone number, so that we can reach their family members by phone. That will facilitate our tracing efforts. We are preparing this measure about the use of SMS. We have to liaise with the service operators for the SMS, and we also have to prepare the electronic forms. We used the electronic forms in the past. For example, health declaration for those arriving in Hong Kong. It's similar to the electronic form we have in mind. The form, once submitted, will be stored on the government cloud and it will only be accessible to government staff. The technology has been in use, but has not been in use for our contact tracing efforts. And the use of such technology may facilitate our efforts. Regarding the complaint you just mentioned, I hope this journalist can give me further details about this case. I cannot give you a detailed response regarding the reason based on what I've just heard. In some cases, when you have a positive case, it may take time for staff to find out how many family members this patient has. So that's why we're using this electronic form and we're considering it. In terms of calculating the quarantine period, we start with the last date of contact.
所以如果個案話因為我哋遲咗揾佢，所以要加到超過好長嘅時間呢，呢個容許我真係揾同事要了解下個案，真係睇睇呢究竟佢有冇其他嘅密切接觸嘅原因。因為如果佢有其他密切接觸嘅一個情況出現呢，個計算就唔同啦，就唔係同佢家人一樣，係同佢其他密切接觸咁。咁所以一定要知道個案實際至可以答得到你。頭先講我哋嗰個叫初步陽性嗰個咧，其實我哋唔係特別唔報嘅資訊，係因為咧，當喺而家個案多，尤其是可能係有啲化驗唔同部分有滯後嘅時間咧，呢個數目就唔會反映到咧實際上嗰個個案個趨勢，我都特別講個趨勢。所以今日張醫生所講俾大家聽咧，其實希望大家明白嗰個趨勢。個趨勢有兩個部分嘅，一個咧就係我哋喺昨日
talking about two things. First, the cases confirmed as of yesterday. These specimens may be received before yesterday, the day before yesterday, because we need 24 hours to confirm the specimens we received. And then there are also the preliminary positive specimens we received. That's the figure reported by Dr. Chuang just then. And that's the best way to reflect the case count we have on any given day. Because we were trying to show you the trend. So over the past few days, we started with 4,000 cases or so per day, and then 7,000 cases or so, and then yesterday we got to the point of 10,000 cases or so reported every day. So that figure included the preliminary positive figures. So we're not trying to withhold any information, but we're trying to show you what's useful to help you see the trend in case count.
Dr. Sarah Ho. I repeat, we have 3,600 confirmed and preliminarily confirmed patients hospitalized in the public hospitals, and we have 2,300 patients isolating in the Penny's Bay treatment facilities, and another 200 patients in Tsuen Wan. For patients who passed away, under the current circumstances, because of the shortage of manpower, we focus the manpower on dealing with emergent patients. So there may be a delay in terms of the information update. So we will try our best to keep you updated. The last question, the lady in the front. Good afternoon, Oriental Daily. Now about infants and pregnant women, if there is no contradiction, they should get vaccinated. So what is the definition for infants? A few months old or a few years old? And about stay home safe, how many patients are there at home? And about the details of the deceased patients, were they vaccinated? Can you tell us again? About the private hospitals, do they not have any negative pressure facilities to take in COVID patients? Is it really the case that they can only take patients on convalescence? How many patients will benefit from the partnership? And do we have patients who have already waited 14 days at home and can leave home? Now, today, every day, we still have CTNs and RTDs. There are so many patients tested preliminary positive each day, but we lack the manpower to deal with them. So what's the point? And do we have patients who caught the disease during the wait for a test? There were patients who have waited for 6 to 7 hours for a test. Despite the ticketing measures, is there still a risk to patients, to people waiting to be tested? Now we will take the first question. I reiterate, I didn't say that newborns should get vaccinated. We all know the eligibility age for children to get vaccinated. According to medical journals, pregnant women are at high risk. There were pregnant women who hesitated to get jabbed because of the possible side effects. So I would like to remind pregnant women, if there are no contradictions, vaccinations against COVID-19 will help. If you have no contraindication, vaccines will help. It is a protection for you and the infants or the embryo. If mothers are protected, then the protection would be transferred to the baby as well. So I'm not saying that babies as young as a few months old should get a jab. About the number of patients at home, Dr. Zhang will take the question on how these patients got infected. Since we have so many cases in the community, it is really difficult to single out the sources, including during a meal outside or otherwise. The point is we have to maintain social distancing and reduce gathering. That will definitely help containing the epidemic. Now, RTD is still necessary when there is a major outbreak, when we are worried about a building where there are a lot of cases, we want to find out all the cases, and then we will do a screening. If we judge that it is not suitable for patients to stay at home and need treatment or isolation at hospitals or facilities, the LTD will surely help us find out these patients. So the current measures are still effective. Dr. Zhuang, as said last night, we have 10,416 patients staying at home. I don't have the vaccination records of the patients who passed away today. Dr. Zhuang mentioned the details yesterday, so please refer to yesterday's briefing. On private hospitals, we have received very positive and enthusiastic response. The initial thought is to transfer people in infirmary care and on convalescence to private hospitals. We still need to meet up with private hospitals to formulate the plan. That is the end of the media briefing. Thank you.